talk about pediatrics. I'm Dr. Rachel Ann Brown, and as usual, I'm always so happy to have you here today with me. So, last time we spoke about breastfeeding again, and today we're going to wrap things up. We're going to talk about some of the issues that you may have that may require a little bit more intervention than just the simple ones we spoke about the last time. These may mean that you have to go see your doctor just to be sure that things are okay. All right, or get some advice from your doctor on what's the next step. Okay, so people often ask, what about medications? Can I take medication while I'm breastfeeding? And it's a very good question because medication sometimes is needed. Now, the answer to that question really is it depends on what type of medication. Now, there are many databases that you can check for yourself and see if the medication that you're on has any impact on your baby, but I do encourage you, please speak to your pediatrician, speak to your doctor so that we can let you know. So most medications, there are no issues with them during breastfeeding, but it's important to know about the combination of medications that you're on, the supplements that you might be taking as well, so that we know all of the things and whether the interactions between them is a good setup and safe setup for you and your baby. So please disclose everything you're taking, and we'll let you know if all of that is okay while you're breastfeeding. All right. People also ask about vaccines. Is it safe to take the vaccine? And people ask about the COVID-19 vaccine particularly. And again, it depends on what vaccine. But most vaccines are safe to take while you're breastfeeding. The ones that we speak specifically about not taking are the smallpox vaccine and the yellow fever vaccine. So if you do find yourself in need of these vaccines, it's important to talk to your physician about what your nutritional plan for your baby will be moving forward, what formula you may introduce, or if there's any way at all you can put off taking these vaccines and continuing your breastfeeding program. All right, so have that discussion so that you can move forward in a safe way. People also ask about the things that they do for fun, like what about alcohol or smoking? Okay, now I must say it's not advisable to drink or smoke while you're breastfeeding at all, but here are some of the facts if you do. So for alcohol, it's important to note that alcohol is found in the breast milk after you've taken it, okay? One serving of alcohol can be found in the breast milk for up to 1 to 2 hours after it has been had, and that duration of time gets longer for every drink that you take. So for one drink, as I said, 1 to 2 hours. For 2 drinks, 3 to 4 hours, and so on. So you really do need to have a plan if you plan to take alcohol in the time that you're breastfeeding. All right. That may mean that you express a feed before. It may mean that you are going to give a formula feed in that time that you plan to take that drink, but it's important to know what you're doing. It's also very important to state that you must not co-sleep with your baby after you have taken any form of alcohol. Co-sleep means to sleep in the bed with your baby or have the baby sleep in bed with you, right? Now, co-sleeping is not recommended at all, but particularly if there has been any alcoholic intake, there has been shown to be an increase in sudden infant death syndrome for parents who co-sleep with their babies after they've taken any alcohol at all. So no co-sleeping once you've taken alcohol. All right. Now for smoking, well, it's not recommended that you smoke for your health, but smoking can also be very harmful for your baby's health and their lung development too. Okay. And when we talk about smoking, we have to think about marijuana as well. And yes, studies haven't shown that there's any direct effect of the marijuana itself. They're not sure, yes or no, whether there's any direct effect of the marijuana itself on the baby. However, with all the adverse effects of smoking, it really would be advisable not to do so. But for some things that you can do if you are a smoker is that please ensure that you change your clothing, wash the mouth, wash the hands. These are the places that smoke has been found to stay long after you have had that cigarette. All right. So before you start to breastfeed, just ensure that you do those things to remove as much smoke from you as you can. We'll also talk about some of the things that happen with the breast itself, one of which is engorgement. Now, what is engorgement? It really is the breast just getting full up of milk to the point that it becomes firm and tender. Now, this can happen particularly in those first few weeks when the breast is still getting used to how much it actually needs to produce. Sometimes it may overshoot the demand. All right, and so the breast gets very full. Or sometimes, as you're working out that schedule and how the baby getting feeds every 1 to 2 hours, every 2 to 3 hours, depending on their demand, then you may find that the breast is not emptied as well as it should be, and so the breast gets full up, right? Now, this fullness can also make it difficult for your baby to get a good latch on to empty the breast, and it can also be quite painful. So some of the things that we can do to avoid engorgement really would be: one, not overstimulating the breast between feeds, because remember that the breast is trying to get an idea of what the demand is. So if we are expressing between feeds by hand or otherwise, it's giving the breast that signal that, oh, I need to make more milk. So we don't want to express too much between feeds. And two, you can ensure that feeds are given on time as best as possible, all right? And three, during the feeding process itself, you can compress against the chest to kind of help reduce the flow a bit. Sometimes that helps the baby to get a better latch on. It kind of slows the flow of milk to the breast and hopefully softens it a bit so the baby can get a good latch and begin to empty the breast. All right. Now there's also the problem of mastitis, and it's similar to engorgement in that there's fullness of the breast and there's tenderness, but it moves on in that there's also some redness at the area, and you can have a fever that's associated with it and just flu-like symptoms, just not feeling well. Now, it's important, if you begin to have pain and fever in your breastfeeding process, that you do go to speak to your physician, because we really do need to make sure that there's nothing else on board that might need antibiotic treatment, whether from the breast itself or anywhere else in your body that we've been monitoring in this special time after delivery. All right. So once it's simple mastitis, it should not require any antibiotic treatment. Pain and fever medication is fine, and you can continue to breastfeed as long as you feel comfortable to do so. All right. We want to ensure that the breast is emptied because we don't want mastitis to move on to an abscess, which really is when pus develops in the breast, and that definitely requires antibiotic treatment. All right. So it's important to treat an engorged breast and ensure that it's emptied as much as you can so that we don't progress to further issues. And lastly, we talk about whether the breast has a discharge. So the milk usually has a creamy white color or yellow when it's in that first few days with the colostrum, but it may sometimes have another color like rusty red or dark red. And sometimes this can be normal, especially if you have cracked nipples. There may be a little bit of blood in the milk as baby is getting used to feeding and as you are getting used to feeding. And this is still safe to feed your baby, all right? But if you're having any other strange colors, any other dark discharge or a bright pink discharge, these are definitely reasons to see your doctor to be sure that nothing else is happening. Now, we expect that you may have a bloody discharge for about a week or so, again, as the breast ducts are getting used to making that milk. But if you're having it for longer, this too should prompt you to go speak to your pediatrician or your OBGYN to make sure that there are no other things that need to be checked out for you and your health. And here on Pocketbook Pediatrics, we are not biased, so I do want to end the conversation just talking a little bit about bottle feeding, because sometimes it is necessary, right? So are there any benefits to bottle feeding? Well, of course, the major one is being able to invite somebody else into that special bonding process with your baby if you choose to, daddy or grandma or somebody special to you, right? And if you have to go back out to work before you want to, or if you're just not feeling well, as we spoke about before, maybe with the mastitis, you just don't really feel up to breastfeeding, you need a little additional support. This is where bottle feeding does provide some help. But there are some things to note about initiating bottle feeds. First and foremost, try not to initiate bottle feeds before baby is well established on breastfeeding. And we say that because we want baby to not have what we call nipple confusion. Nipple confusion really comes because feeding at the breast is work. It's work for the baby, so he does have to give some effort to get his milk. But getting milk from a bottle is not as difficult. Milk flows freely, everything is nice. And so when baby gets used to that, oh, this is easy, they can become a little bit lazy. And so when you put them back to the breast, they don't really have the desire to suck as much. But when they're about a month into things, they kind of have this down. They know what's supposed to be done when they're put to the breast, and there's less of that difficulty between bottle and breast. Other things that can help is making sure you choose the right stage nipple for your baby. So there are different stages, and again, different amounts of effort is required for the different nipples. So be sure that you're not using a 3-month nipple for a newborn baby or a 6-month nipple for a 3-month baby, but you choose the right stage for where your baby is at. The wrong size of a nipple as well, aside from providing too much effort, can even provide too much flow, and so baby can have difficulties just from trying to control too much milk coming in at one time. So we just want to be sure that we're using the right stage. And also there are special nipples that have what we call an ergonomic feature, or they specifically state that they are to help prevent nipple confusion. And that means that these types of nipples, the effort that you'd use to get the milk from them is the same type of effort baby's going to use to get the milk from your breast. And so again, that reduces your difficulty between breast and bottle. And I should say as well, there are special populations that need special nipples. There are some babies who definitely benefit from the use of nipples, such as babies who have a cleft palate. These babies may need what is called a long teat nipple. So if you do find that you have a baby that has these difficulties, speak to your pediatrician about some of the options for you as you move forward in the corrective issues for your baby. We want you to have a good feeding journey as well. So thank you so much for joining me here in Pocketbook Pediatrics again here today. Please do put your comments down below, whether you are camp breast or camp bottle, for whatever reason. We want to hear about it all. It's important to us, whatever you're doing for your baby. And of course, put that story about your breastfeeding journey. You never know, again, which mommy you might be encouraging with your breastfeeding story, or your breastfeeding tips might just be the one to help them get over a particular hurdle. Thanks for joining me. I've enjoyed having you here today. I'm looking forward to seeing you next time on Pocketbook Pediatrics. God bless.